limbic system is the part of the nervous system that assigns emotional loading to other sensations, helps us to process experiences that we've had. It's made out of several different parts of the brain: the cingulate gyrus, the parahippocampal gyrus, and the hippocampus itself. The amygdaloid bodies also help in different aspects of emotion and emotional memory, especially fear. The olfactory bulbs, the olfactory cortex, and also the fornix. There's lots of nuclei that participate in the limbic system. Here you can see a mid-sagittal cut of the limbic system. Here is the cingulate gyrus, along with the fornix, the mammillary bodies that are connecting to the fornix and running around all the way over toward the amygdala. And then here is the hippocampus, which is really important for forming memories. The limbic system is important in establishing and forming memories and giving us emotional loading so that we can remember things more easily. For instance, if you are afraid of something, that amygdala really kicks in and stimulates the hippocampus to really remember something. But that memory is also associated with fear, and that's to get us to stay away from whatever it was because it was dangerous. The limbic system is also involved with olfaction. Remember, olfaction was the single sensation that does not run through the thalamus, the big switching station in the brain. It goes straight into the limbic system, which is why smell can be a very strong evocator of emotions. The reticular formation is some loosely organized gray matter in the brainstem. The important part is called the reticular activating system, or RAS, which helps to move us for different states of consciousness and make us more alert to things in the environment. I want to talk about consciousness for a minute. Consciousness comes in degrees. Fainting or syncope is a brief loss of consciousness. A stupor is a more pronounced lower level of consciousness where you can arouse somebody from the state, but only with extreme stimuli. For example, if somebody's in a stupor, they're not going to respond very well to gently shaking their shoulder and telling them to wake up. You're probably going to have to give them a slap across the face. A coma is deep and profound unconsciousness, and in this case, even extreme stimuli are unable to arouse a coma patient up into higher states of consciousness. So don't do this, but if you gave a coma patient a sharp slap upside the face, it's not going to cause them to wake up. And a persistent vegetative state is the lack of thought and awareness, but the non-cognitive functions of the brain continue. There's no thought going on, but the brain is still keeping the body alive. Higher order brain functions include learning and memory and reasoning, and all these occur within the cortex of the cerebrum. As the central nervous system develops, the ability to process higher order functions becomes more complex and more mature. Most axons are still myelinating during the first 2 years of life. You may have noticed that your 1-year-old isn't very coordinated, and this is one of the reasons why. Brain growth in early childhood is extremely rapid, but most of it's complete by about age 5, which is why early childhood development is so critical. Some central nervous system axons, especially the prefrontal cortex, are still undergoing myelination even into adolescence. An EEG, or an electroencephalogram, is a measurement of the electrical activity in the brain. This is done by attaching electrodes to the head, and we use these in sleep studies, looking at coma victims, and we can use these to evaluate epilepsy and seizures. EEGs measure the electrical activity in the brain. We've designated them into waves. We have alpha and beta and delta and theta waves. Alpha and beta are used in wakefulness, and delta and theta are more common in sleep. The beta waves, you can see there at the top, cycle about 14 to 30 times per second. That's what a hertz is. And this is normal, kind of everyday thought patterns. Alpha rhythms are awake and resting at about 8 to 13 hertz. Sleeping is theta, and then deep sleep would be delta waves. Sleep is a temporary and natural absence of consciousness. We basically divide it into REM sleep, or rapid eye movement, and non-REM sleep, which is non-rapid eye movement. Your requirements for sleep change throughout life. Lack of sleep is unhealthy, and it's associated with depression and poor immune system function. Insomnia is the inability to get to sleep or stay asleep. And sleep apnea is the cessation of breathing during sleep. This is treated with a CPAP machine, which stands for continuous positive airway pressure. Cognition is the mental processing that we use to think about things. Knowledge, memory, perception. We're going to use different areas of the cerebrum to do different functions, and all of them are going to work together. Studies of brain lesions in patients have helped to explain normal function. For example, Phineas Gage, with losing part of his frontal lobes, had a change in personality. If we have a patient who's damaged their primary somatosensory cortex, then they're going to lose sensation on the opposite side of their body. Agnosia is the inability to recognize or understand stimuli. Memory comes in different types. There's sensory memory, which is memory of color patterns or smell or taste. There's short-term memory, which has a pretty limited capacity, and it's very brief. And then long-term memory, which needs to be encoded from short-term memory. So say a stimulus happens, it's perceived by a sensory organ, and that perception is sent to sensory memory. And if it wasn't important, it's pretty quickly forgotten. If it's something that you needed to be aware of for a few seconds or a few minutes, then that gets loaded into short-term memory so that you can remember why you walked into a room, say. And then long-term memory is going to take a while to load in, but once it's there, you can have it for days or months or even years. So the trick with students is to get your short-term memory of A and P into long-term memory. To encode memory, we need the amygdala and the hippocampus, which, remember, are both part of the limbic system. Motor memories are stored in the premotor cortex, and memories of sounds are stored in the auditory associative cortex. Alzheimer's disease is the leading cause of dementia worldwide. It is a slow progressive loss of higher intellectual function. It usually starts after age 65. Patients will have changes in mood and behavior. There is no cure, and we're not sure why it happens. There's no underlying cause known. As I talked about a little bit earlier, emotion is taken care of by the limbic system, but the expression of emotion is controlled by the prefrontal cortex. The amygdala and the hippocampus are very important structures in emotion, and if either of these are damaged or artificially stimulated, then emotions can be deadened or exaggerated, and learning can be impaired. Language is really interesting. We've got the motor speech area, also known as Broca's area, on the left lateral aspect of the frontal cortex. And then we've got Wernicke's area, which is more onto the temporal parietal lobes. Wernicke's area, also typically on the left, helps to interpret spoken language. With language, the categorical hemisphere analyzes the literal meaning of speech, whereas the representational hemisphere analyzes the emotional content of speech. If we have a lesion to the right hemisphere opposite Wernicke's areas is on the left, then we can cause a prosodia, which is dull, emotionless speech. Apraxia is a motor disorder of speech. The person's aware of what they want to say, but they cannot actually form the words properly. And aphasia is difficulty understanding or producing speech. Aphasia is the difficulty in understanding or producing speech, usually due to a head trauma. And the patient might not be producing understandable speech, but they're often not able to recognize that they're not producing understandable speech. Dyslexia is an inherited learning disability. It's a problem with single word decoding. Individuals can have trouble reading, writing, or spelling. So their level of reading competence tends to be below what you would expect. Improvement is possible in some individuals with time, and this could be a form of what we call disconnect syndrome, which is the impaired transfer of information through the corpus callosum.